Good day, everyone. I'm Dr. Evaristus Chukwudike, a consultant gastroenterologist and hepatologist and director of endoscopy at Redus Centre for Digestive Health, Lagos, Nigeria. I'm here to talk about liver cancer. Liver cancer is the development of uncontrolled growth or abnormal division of tissues and cells in the liver. There are different types of growth in the liver, ranging from the ones that are non-cancerous and the ones that are cancerous. The non-cancerous ones do not invade adjacent tissues and other organs. Example of these ones are the hepatic adenoma, hepatic hemangioma, hepatic epithelioma, fibronodular hyperplasia, and others. These ones are called benign tumors of the liver. There are those ones that cause cancers. They are cancer-forming tissues and cells. Example of these ones are the hepatocellular carcinoma, which are the abnormal development of cancer in the primary liver cells called hepatocytes. Others are fibronodular hyperplasia, which is also a form of hepatocellular carcinoma, but this one occurs in a very young age people, especially the female. We have hepatic angiosarcoma and even hepatoblastoma and all others. These ones cause cancer. They are cancers that can develop from the liver. In our environment, the liver cancers are mainly caused by chronic viral hepatitis, known as chronic hepatitis B infection, chronic hepatitis C infection. Other causes, in fact, in Nigeria, about 8.1% of Nigerians live with chronic hepatitis B infection, and 1.1% of our population also live with chronic hepatitis C infection. When you put these figures together, you now realize that over 20 million Nigerians are living with both hepatitis B and hepatitis C infection. And these are the major drivers of liver cancer in our environment. Other causes of liver cancer are the excess consumption of alcohol, which can progress and over time, and some of the patients will develop liver cancer. We also have non-alcoholic fatty liver disease, what we commonly know as fatty liver. We take it for granted, but no more. We do no more take it for granted because non-alcoholic fatty liver can also progress, and some people may progress and go through the route and develop cancer from it. Currently, the world has renamed it as metabolic dysfunction associated steatotic liver disease. Okay, so there are other risk factors like obesity, which and diabetes mellitus, which will go through the route of non-metabolic associated metabolic dysfunction associated steatotic liver disease. That's the fatty liver. So these are the major causes of liver disease, liver cancer in our environment. We have all the rarer causes like the hereditary disorders that can also cause liver cancer. So the liver is the organ that plays vital role in our day-to-day activity. So we need the liver to be functioning well for us to have good health, ranging from storage of our glucose that in the form of glycogen that the liver now begin to bring back for us to maintain our energy level, to production of important proteins, clotting factors, even helping us to curb infections that come into the body. So when the liver is sick and is unable to carry out these important functions, many things can happen to the body, ranging from fatigue, ranging from one will become excessively tired, ranging from one development of swelling of the abdomen, which we call ascites in advanced phase, vomiting of blood when those who have developed what we call esophageal varices, from what we call portal hypertension, and down to many other causes. Even some people have disorientation and alteration of their senses, which we call hepatic encephalopathy. There are so many complications that can arise as a result of liver disease. And this, for one to develop liver cancer from this, for hepatitis B infection, we may progress over time from development of acute viral hepatitis to chronic to liver cirrhosis, which is what we call end-stage liver disease. And some of these patients can progress, about 12.5 to 15% of them may progress in 5 years to liver cancer. The same is what we also see it in hepatitis C, where this progression goes on. In the early phase, these patients do not develop, people that develop liver cancer, they may not even show symptoms at the early phase. And so when these symptoms begin to show, which our people know very well, as a patient that has liver disease, when they begin to develop yellowness of the eyes, the eyes are yellow, the abdomen is swollen, the legs are swollen. At that phase, the disease has gone very far, it has advanced. And so we do not wait to develop jaundice, which we call yellowness of the eyes, or develop abdominal swelling or leg swelling before we know that the person has liver disease. So what should we do? The best thing we should do to curb the liver cancer development, which is increasing in our environment, even in our young age people in Africa, especially in sub-Saharan Africa and Asia. One of the most important thing we should do would be to screen ourselves for viral hepatitis, which is the major driver of liver cancer in our environment. Do your check to know whether you have hepatitis B or hepatitis C. If you do not have hepatitis B, you need to go and get yourself vaccinated. There are 3 doses you need to take. The first dose, the second dose, and the third dose. That is when you have protection. Hepatitis C does not have any vaccine right now, but hepatitis C is curable. And the gain from cure of hepatitis C is best made when the patient is diagnosed early and treated before the patient develops cirrhosis or advanced liver disease. Because even if you cure the patient of hepatitis C and cirrhosis, advanced cirrhosis has already set in, there may be the risk of progressing to liver cancer is still high. The same is true of hepatitis B. If someone has hepatitis B infection, one can start treatment early time, and then so that we can limit the progression. What is this progression? Progression from chronic hepatitis B to when the liver becomes scarred, what we call fibrosis, to when the liver develops cirrhosis, and then from cirrhosis it progresses to liver cancer. This is the way to stop progression of this disease. If you are not infected, you'll be vaccinated. If you are infected, you will start treatment that will retard the progression that will ultimately lead to liver cancer in some of the patients. So the treatment of liver cancer is a bigger problem, because in Africa in Nigeria as of today, there is no place liver is transplanted. So these are patients that will develop liver cancer. A good number of them will die because they may not have the money to go for liver transplantation. And even when they have the money, it takes time to get liver to transplant to an individual. So these are the major problems. And those that are diagnosed early, these are people that may get the liver surgeries, like like resection of the liver. The others may now progress to transplant. But a good number of people come very late that they will not get this. So they will depend on the best supportive care, and death in this set of people is very high. So I encourage our people today to know that liver cancer is real and is ravaging so many homes. I've managed a family where 6 children of the family, they've had hepatitis B infection. And at the time we were managing, we diagnosed the first person and began to screen every other member of the family. 6 of them were positive for hepatitis B. 3 of them were already having liver cancer. So for a family to go through this is a serious problem. Go through, and what does he tell us? There is this family, they're infected from their family. So we encourage everybody to go and screen for hepatitis B and hepatitis C today. And then if you are not infected, get vaccinated for hepatitis B. If you're infected, rush to the hospital and meet specialists so that they start you on treatment. If you are infected with hepatitis C, you will be treated, you will start treatment immediately, and there is cure for hepatitis C. This is the message we want to pass to our people, and we believe that if we do all this, we will begin to limit the increase we're seeing in liver cancer in our environment. Thank you.